Hey, Dr. John Swetech here from Swetech Medical Center. One of the videos I wanted to make for you guys at some point was one about Lyme's disease. We'll expedite that a little bit because I was out tonight and I noticed a deer tick on my skin. Fortunately, it didn't bite me, so that's great news. But I do want to tell you guys a few important points to know. In Michigan, there are deer ticks. They call them the exodase ticks, and they can carry a parasite called Borrelia burgdorferi, and this causes Lyme's disease. So if you ever get bit by a tick, there's a few different ways to get them off. I've heard everything from putting some dish soap on them to pulling them out with tweezers. I've had a few patients along the years that have come in with ticks in their skin at the office. Usually we pull them out with tweezers, but there's like 10 different ways, to be honest. You do have to worry about a secondary bacterial infection on the skin. They can certainly cause a cellulitis because they do have all kinds of germs on them. So if you do get bit by a deer tick, it's probably worth being treated with a prophylaxis dose of doxycycline. Full-blown Lyme disease is a dangerous thing and can cause all kinds of problems, so you want to be careful. It's worth being treated. So one of the first signs of Lyme disease, and only about 80% of the people will get this, is called erythema migrans. It's a rash, and it usually doesn't happen where you got bit. Erythema means red, and then migrans means migrating. It usually looks like a little target sign. We'll try to post a picture of this and the deer tick for you. So basically, if you see this rash, you should also probably be treated with doxycycline. There's a few other ways to be treated as well. A couple of things to know: full-blown Lyme's causes chronic fatigue. It can cause joint aches. It can cause heart blocks. All kinds of symptoms. Come across a few patients along the years that have had all kinds of chronic symptoms that are quite difficult to treat. As they get full-blown, you usually probably need a specialist on board to treat these things, but it does respond pretty well to doxy in my experience. I've had a few patients along the years too that had some weird symptoms, some chronic fatigue with upper respiratory symptoms, and we've tested them for Lyme's and they came back positive. They may or may not have had a known tick bite, so sometimes if you do have these random symptoms, it's worth being tested, and these patients fortunately did respond very well to the treatment. Let's see what else. So we talked about deer ticks, we talked about the rash, we talked about some of the other things. The point is, I want you guys to know that if you do get bit, you probably should get treated. You know about the erythema migrans, and I've seen a few people also along the years that got a secondary Babesia infection. Don't know a whole lot about that, as we're not infectious disease specialists, but it sounds like these ticks can carry some other weird things too. If you're out in some brush or anything, definitely check yourself, make sure. And if you do get bit, it's worth doing a few treatment of doxy. Let me know what other topics you want me to talk about. Hopefully this one's helpful for you guys, and have a great day.